Hi, welcome to Functional Fridays. I'm Dr. Sherry Jacobs. I'm a naturopathic doctor, certified nutrition specialist. I'm with Shannon Kennedy, internal medicine doctor. Today we were going to talk about our favorite hormone, and that would be
Progesterone.
Progesterone.
Yeah.
Very safe hormone. It's one of the reasons, very safe, very effective, and I think one of the first hormones that we see low around perimenopause, and is responsible for things people often contribute to estrogen, like hot flashes and low libido and aging skin and all kinds of things. But really, it's not just around perimenopause. You can see progesterone deficiency show up much earlier and contribute to issues like PMS and fertility.
Yes. Yeah. We definitely check progesterone on patients from the time they're adolescents all the way through menopause, and also check it on males as well. Having an imbalance in estrogen and progesterone will contribute to anxiety and sleeplessness, which then contributes to overeating, weight gain, type 2 diabetes. I think if we can feel calm and get a good night's sleep, it'll prevent a lot of disease, and that's why progesterone is my favorite hormone, because to me progesterone means peacefulness and sleep.
Yes.
And in my own life as well as my patients.
I know, I call it the world is okay hormone.
Yes.
The world is okay. Sometimes in the literature, if you're actually looking up studies around progesterone, they sort of, back in the day, lumped progesterone, natural progesterone, into the same category as synthetic progestin. And so some patients will do their own Dr. Google research, and they'll look and they'll get afraid. They'll be afraid of progesterone. But just know progesterone is very different from the synthetic progestin, and it is protective even for lots of cancers. We see what the research is showing us.
Absolutely. Progestin is what you would get synthetically in hormone replacement that is not bioidentical, and in birth control pills. And while it does balance the estrogen in the body and is actually effective in lightening periods and lessening cramps around periods and also for birth control reasons, it doesn't have the calming effects. And since the body anticipates that it has enough progestin or that balancing effect, it doesn't make its own progesterone. And so even for patients, especially young women who are on birth control pills, if they suffer with insomnia or anxiety, I'll often put them on an oral natural progesterone. Or if it's mostly just anxiety and not sleeplessness, at over-the-counter topical progesterone, and their mood will improve and their sleep will improve. And sometimes we can keep them off anxiety medication or sleep medication.
Yeah, much safer approach.
Yeah, and then of course women through their 40s, with anxiety and PMS and all that, having progesterone, oral progesterone right before their cycle begins can help them not have the mood swings and the sleeplessness and the anxiety that men experience before their periods, and also menstrual migraines. So women who get the drop in progesterone right before they menstruate and they have awful migraines, if we give them progesterone, we can help with that.
Yeah. I can't believe sometimes how I think when it comes to symptoms of PMS and perimenopause that we feel like, well, they're common, like everybody has them. This is just the way that I'm supposed to live my life, and it's just not true. I mean, they might be common, but they're not normal. It's not what the body should. I believe that in a well-balanced system, you should wake up one day and be like, it's day 28 and I started to bleed. Not have this huge, so many women have half of their cycle or a whole week out of their cycle where they just don't feel like themselves at all. And that's a big quality of life issue.
Right. And I think one of the reasons they think that it's normal is because, if my body's doing this and I eat relatively healthy and I'm living, a relatively healthy life, then this just would be normal. But there's so many environmental factors that affect our hormones. I think our environment it supports having high estrogen levels, and then when our body's natural progesterone declines in our 40s, then the environment that has supported so much high estrogen levels takes over and it might become a little difficult to be around. So.
Speak for yourself. And I would like to mention too, when it comes to testing hormones, that can get a little hairy, especially in a more conventional setting, because I think a lot of doctors don't like to test hormones in a cycling female because they're like, well, they're going to be all over the place. Yeah. Why are we going to look at these hormones if we don't really know, where you're at in your cycle or what to do with them, because that's the whole nature of cycling is, you know, everything's fluctuating. So it's really important to get hormones tested on certain days of the cycle, usually on day 19 to 21, but certain day of the cycle, so that we can really look and we can see what a really robust progesterone would look like, and that we can compare it in relationship to estrogen. And that's a really important piece, is not just your overt progesterone or your overt estrogen, but the ratio of those two together.
Yes, very important. And those are things too that if you've tried progesterone in the past and it hasn't worked for you, and you didn't have close follow-up testing to see what your ratios were, it might be that you didn't have enough or that you had too much. And so it's important to, you know, to try it and then to also have follow-up testing to see where you're at, because everybody metabolizes these hormones differently and also absorbs them differently. So you might need an oral form versus a topical form, and it's not straightforward, but it is effective if we get it right. So.
Yep, like the body, hormones are complex, but worthwhile to look at and try to figure out what's right for somebody, because we want to have that peaceful, life is good hormone in our system.
We want our sleep.
Happy Friday.
Happy Friday.